Welcome, everyone, to Mental Health Recovery Starts with Safe Housing. Welcome to today's webinar. I am one of your hosts. My name is Maggie DeCambry Borges. It's a privilege to be here today. We have a very exciting webinar planned for you. I have two of my fellow board members of the Florida Advocates for Behavioral Health who will be joining me this afternoon. Catherine Murphy, who's president and CEO of NAMI Palm Beach County, Gail Giese, board member, Florida Mental Health Advocacy Coalition, and Amy McKellen, president, Florida Advocates for Behavioral Health. Florida Advocates for Behavioral Health is dedicated to helping Floridians understand how Florida's behavioral health system works and how to advocate and make it better. We are a learning community with a mission to educate citizens on the behavioral health issues and policies that are designed to improve the lives of individuals and families living with mental health disorders, behavioral health conditions, while decreasing stigma through increased understanding. The Florida Advocates for Behavioral Health is a tax-exempt organization under the Internal Revenue Code, Section 501c3, and of course, contributions to the Florida Advocates for Behavioral Health are deductible as qualified charitable contributions. Today, our sponsors are, I'm very pleased to introduce our sponsors. We have three sponsors for today's webinar. Premier Wellness of South Florida, and Citrus Health Network, as well as Bristol Myers Squibb, all of whom support our efforts to educate Floridians about the importance of safe housing for people living with mental health conditions. Just want to take a few moments to orient you to today's housekeeping. You'll have access to a recording after this webinar has been completed and the slides on the Florida Advocates for Behavioral Health website. Attendees will be muted until the very end when you may ask questions and you may have comments that you'd like to introduce at that point. During today's webinar, please use the question and answer for questions, and we will address them at the end of the presentation. At the end, you can also raise your hand and we will unmute you to make your comments. There'll be a very short survey that pops up when the webinar has ended. Please take a few moments to complete the survey, as your feedback will help us with our next webinar.
Hello, everybody. Catherine Murphy here. A brief update on my title. I'm not actually the president of NAMI Palm Beach County, but I am the CEO. I'm really excited to be here today. And why are we hosting this webinar? So we recently hosted another webinar on gaps in services. And after that webinar, we asked our members and stakeholders, what do they want to learn about? So individuals who have mental health conditions, people who care about them, behavioral health providers, all weighed in and shared about what they'd like to learn about. And supportive housing was a top item that they wanted to learn about. We also heard from nearly 200 mental health advocates who answered a survey conducted by the Florida Mental Health Advocacy Coalition, and they rated this topic as the highest priority for legislative action, along with supporting 988 and the Suicide and Crisis Lifeline. So, all of these constituents are very important to our work, so we're grateful for everyone who responded to that survey and let us know that this topic is important to you. So when is safe and stable housing or residential treatment absolutely essential to a person's recovery? Okay, when someone without a stable home coming out of an acute care setting, like the state hospital, crisis stabilization unit, or regular hospital after a psychiatric stay, may need the support services of residential care or supportive housing. A person who is leaving jail, prison, or a homeless shelter. As well, what we hear a lot here at my affiliate is a growing population of adults who have lived with their parents their entire lives, and their parents are unable to care for them any longer. If we were to look at the housing continuum, We'll be exploring what types of housing and residential care for people living with mental illness exist. And this chart shows you what Florida's housing continuum and the safety net system includes. Ideally, each person needing housing should be evaluated and given the opportunity to live in the most independent setting that meets their current needs. And we're going to learn more about these levels of housing later in the webinar. But as you follow along in this chart, you'll see short-term residential treatment, including a locked facility, and then moving along the arc here from least independent to more independent, we have long-term residential treatment facilities level 1 and 2, assisted living facility, shared home, and supportive housing.
Thank you, Catherine. At this point, it's my pleasure to introduce our two guests today, our two guest panelists, William King and Stephanie Berman, both experts on this topic. Just to give you a little bio on each of our panelists today, William King is the Director of Housing and SOAR Entitlements at Broward Behavioral Health Coalition, which is one of our managing entities, and is known by many for his encyclopedic knowledge of behavioral health housing. William is an EPIC awardee from Mental Health America of Southeast Florida for empowering people in our community. We also have the pleasure and honor of having Stephanie Berman Eisman today, who is the CEO of Carrfour Supportive Housing, also a recipient of the EPIC Award. Stephanie is, as I mentioned, the CEO of Carrfour, which is a nonprofit supportive housing developer with projects throughout Florida. Stephanie is a Miami native who joined the Carrfour team in 2002. So let's start the conversation today with William. William, outside of hearing from peers and family members about the need for housing, which I'm sure you hear that on a regular basis, is there other data that's available that tells us about the need for housing and residential treatment for persons that have a serious mental illness in Florida?
Yes. Well, hi, everyone. I would thank you all for attending this. I do want to thank you all for attending, taking time out of your day. But as Maggie was discussing, there are actually, you're going to see a common denominator and a common gap that's identified in 3 different statewide evaluations or analysis. One started with DCF, was presented with the task of analyzing, the gaps in the behavioral health system. One of those main gaps that was identified by Ernst & Young's study, and these studies can actually be looked up. There will be a link to each of them. That way you can go and look in depth at some of these studies, because it identified behavioral health gaps across the board, but the main ones that come in, the most common one for each 3 of these analysis was the gaps in safe housing, safe, affordable housing. The Ernst & Young's analysis was presented to the governor, just so they're aware of what's going on. And obviously it recommended and identified that there is a shortage of residential treatment beds throughout Florida, and their recommendations were to increase those beds. So the other studies that were put in place was a statewide permanent supportive housing work group, as well as each managing entity. We have 7 managing entities here in the state of Florida, each covering their respective areas. But each managing entity is required to do a triennial needs assessment, which essentially we survey our network providers throughout our communities. And obviously they were identified that one of the biggest gaps that we have is the need for affordable housing. Contractually, that we have to conduct these needs assessments every 3 years. So the data is pretty recent, pretty current. Actually, the most recent one that was conducted for us, for our managing entities, was conducted in 2025. So these triennial needs assessments are on each of our managing entity website. We're going to identify those in a couple slides later, but you can access these analysis, these needs gap assessments on our websites. There's a lot of information involved with them, but today, we're talking about the safe, affordable housing that is such a dire need. So, let's see. I'm going to go on to the next slide.
All right, so thank you, William. I really appreciate that. Now we're going to turn it over to Stephanie Berman Eisenberg. And Stephanie, I'm wondering if you can tell us about supportive housing, what it is, and the efficacy for people living with serious mental illness.
Sure. Thank you. And thank you all for joining us today. Housing, as I guess we're all identified as a huge need, that's why we're all here, but it really requires a village and a community to bring initiatives and creative developments forward. So we appreciate your time here today. I'm going to spend just one quick minute, because I know time is short, talking about Carrfour. And Amy, if you can advance the slides, and then I'm going to jump into what supportive housing is. So Carrfour Supportive Housing is a not-for-profit developer, operator, and provider of permanent supportive housing. The bulk of our work has been in South Florida, but a couple years ago, we started doing some developments outside of South Florida as well. And now we're doing work throughout the state of Florida. Go ahead, Amy. Our mission is to confront homelessness by developing affordable housing and providing supportive services as a pathway to self-sufficiency. We're guided by a vision where everyone has safe and decent housing and is self-reliant. We currently have 26 communities that we've developed throughout the state. I'm going to dive a little deeper into a couple of them at the end of my presentation. But all of them are a little bit different in their size, what they look like. But the commonality is who we serve, which are folks with a disabling condition, many of whom have a severe and persistent mental illness and who have long histories of residential instability, whether they're coming out of our continuum of cares, coming out of homelessness, being on the street, or whether they've, had years of couch surfing and didn't make it onto the streets, but have, long histories of residential instability and have kind of done their best to figure out their own solutions without ending up on the streets. So what is supportive housing? I think I'm going to just start out by saying what it's not, because often it's, there's a lot of preconceived ideas when folks hear the word supportive housing of what it is. And what it's not is a lot of the restrictive settings that we just heard about at the beginning of the webinar today. It is not residential care. It's not an ALF. It's not a group home. It's not a shelter. It's not all of those things that sometimes folks mistake supportive housing for. Supportive housing is a model of housing that is true, independent housing, where folks can live independently and get on-site supportive services to support them. It's a solution for combating homelessness. And what the services on site look like is different depending on who the developer is, who the operator is, or the community that it's in. But here are some of the common services that are typically found within supportive housing, which are case management or care management, connection to healthcare services, connection to behavioral healthcare services, recovery support services, employment services, income maximization services, including entitlement benefits. And key to the supportive housing model is ample opportunities for social and community interaction. And for this population that we're talking about today in particular, that is particularly important. Looking for opportunities for folks to form community and to combat isolation. Physical and behavioral healthcare services are a core component of the services in supportive housing and a key to keeping folks successfully housed within supportive housing. So these are some of the key components of what permanent supportive housing is. Residents pay rent. There is an expectation that folks are able to pay some level of rent. In our communities that Carrefour's developed, we charge 30% of whatever income the individual has, whether it's entitlement benefits or employment income, as rent. Residents have a lease. It's an annual, it's an annual lease And we wear a landlord hat in addition to a service provider hat. And we, hope that folks are at the point in their journey where they can abide by a lease. But we also honor that they're in a place in their journey where they can honor their lease. And, we don't check who's coming and going, who's, taking their medication that day. Permanent supportive housing is really for folks that are at a place in their journey where they're able to manage that on their own. So what the staff do on site is provide a safety net of services to make sure that if someone needs something or encounters some barrier to service that would ordinarily move them or propel them back into homelessness or into a more restrictive environment, they're there to support them. The services are flexible, they're resident driven, they involve the resident in determining what their goals are and what services they need to access in order to achieve those goals. And the level of services and needs change over time. All of us have different things that come up in our life at different points in our life where we might need more intense services or less intense services or a different array of services. So the service provision behind supportive housing is flexible and individualized. Community integration is a critical component of permanent supportive housing. Really creating a community, a housing community that doesn't feel like a facility, but that just feels like a apartment building within a community. And the key to who is ready to live in permanent supportive housing is that residents must be able to live independently and be a good neighbor. Folks need to be at a place, like I said before, where they can follow the rules of a lease and be a good neighbor. Really, that's critical to the success of a permanent supportive housing community. Amy, can you advance the slide? So here are some positive outcomes of permanent supportive housing. Housing increases the likelihood of engaging in behavioral health services. That's pretty obvious. It just, but it's important to state that when you have a place to come home to and lay your head at night, you're more likely to stay connected to the services that you need, whether it's behavioral health services or physical health services or recovery. Substance abuse recovery. Tenants stay housed within permanent supportive housing. They improve their physical and mental health outcomes. They form social and community connections. They tend to increase their income level. And for communities, it is a way to reduce homelessness and save money. And I'm going to talk a little bit about the cost savings. Amy, if you can advance the slide. Because often, even though I'm guessing that most of the folks on this webinar, want to see folks housed because that's it's in our soul and it's our mission. But sometimes other folks that we need to influence speak a different language, and sometimes the savings in a community are what really motivate communities to look into permanent supportive housing as an alternative. So there are a bunch of studies out there that talk about the cost savings to a community when you develop permanent supportive housing, but I wanted to spend a couple of minutes talking about a research study that we did, Carrfour was part of in Miami-Dade County several years ago. It's time to do a new one. That showed the effectiveness of permanent supportive housing in reducing costs to the community in other systems, such as the shelter system, the behavioral healthcare system, the jail system, and the public hospital system. So a few years back, Carrfour was part of a group in Miami that developed Coalition Lift. It was a small supportive housing community that had a research component, and it served the highest utilizers of the most expensive systems of care in Miami. So literally all of the groups that I talked about sat around the table and compiled a list of who those high utilizers in the community were in Miami. And our outreach teams went out and found those folks, and over a period of time engaged them to come into housing at Coalition Lift. And there's a lot more to that story, but for today, since we don't have too much time, I just want to skip to the end, which is where we look back after 3 years on what the savings to the community were, and you can see on the slide what some of the biggest savings were, which were to the physical, to the primary care, which was to our Jackson hospital system, our big public hospital in Miami. Shelter costs dropped, jail costs dropped, and mental health costs also dropped. So sometimes that's the hook, that we need communities to lead with when they're trying to develop permanent supportive housing in their community is the savings that they'll see in these other systems. And quickly, I just want to go show you some of the permanent supportive housing that Carrefour's developed. And I think we're going to focus on Miami, Broward, and one in Melbourne. So Northside Commons is one of our housing communities in Miami-Dade County. It's 80 apartments that are a combination of permanent supportive housing for adults with a severe and persistent mental illness and 24 units of affordable housing. Carrefour's model of housing, back to the community integration model, is to combine populations within one building, not just to house folks coming out of homelessness or just house folks with a severe and persistent mental illness within a building, but to try to create a true diverse community within our buildings where not everyone has the same background or experiences. So we like, when possible, when the funding allows, to mix the permanent supportive housing with traditional affordable housing. Northside was our first development when we incorporated a clubhouse. We have the Key Clubhouse on the ground floor. And we have units set aside within the building for the clubhouse members. We were really excited about that partnership. We had great success and outcomes and decided to try one in Broward County, which I believe is our next slide. Yeah, it's Southwest Hammocks, which opened about 2 years ago now, which is 100 units of permanent supportive housing, also a mix of permanent supportive housing for adults with a severe and persistent mental illness and traditional affordable housing. And we also have an on-site clubhouse, which is Footprints to Success. Again, it's been a great collaboration. The idea of having folks be able to go down and work, in the clubhouse during the day as members and then come upstairs to live in their independent housing has been a great way to support our residents. And we're really excited about trying to figure out how we can do that same model throughout the state of combining the clubhouse model with permanent supportive housing. And the last community is the Heritage Park at Crane Creek. It's a supportive housing community that we developed in Melbourne, in Broward County. It's 100 apartments. And what's really neat about the two things that are neat about this community is it's the first one in Florida that's a mix of supportive housing, affordable housing, and true market rate housing. So back to the idea of mixing populations and creating, true community-like communities where, we're not just focusing on one population with one background, but really trying to create a community that any of us would live in with a lot of diversity of income levels and experiences and backgrounds. We found that that's how our folks are most successful. That's how they do the best, is when we create these communities that are mixed communities. The Heritage Park development has an on-site health clinic that provides both behavioral health care service and primary care services. Again, a great amenity for the residents in the building. They can come downstairs and get the services they need right on site and, live independently in their units in the housing community. And that's what I got. Thank you.
And Stephanie, thanks so much for that wonderful explanation of supportive housing. If somebody was interested in learning more, they want to find out about the projects or the availability of units, where would they go to?
Sure. Well, for Carrfour communities, you can, here we have a whole slide. I would say for Carrfour communities, you can reach out directly to us. We're on the slide. But here you see on this slide several other developers that have been funding by Florida Housing Finance Corporation to develop supportive housing communities. You can see that they're throughout the state. In Pinellas County, up north, in Jacksonville. So there's several communities that Florida Housing Finance Corporation has funded throughout the state. These are all buildings similar to Carrefour's buildings. There are also a lot of not-for-profits in our communities that do scattered site permanent supportive housing, which is another model of housing. And the best way to see where those providers are in your community is to reach out to either the COCs in your community or the managing entity in your communities.
Thank you. And we've been seeing headlines about changes in the way proposals around how supportive housing is funding. Can you speak to us about what's going on and how that impacts supportive housing projects?
Sure. Yeah, it's still an evolving story, so I don't have a conclusion to where we have landed. But some of you might have seen a lot of emails circulating asking for advocacy or newspaper articles about recent HUD funding cuts to permanent supportive housing, which is going to have a huge impact on our communities if it does move forward. Right now it's in limbo, it's in litigation. There's been several versions of different funding applications out. So there's a lot going on, and every day has been a new day in what information we have or where we think we are. But what happened earlier at the end of last year, actually, when HUD put out their application for funding, for the funding that supports most of the permanent supportive housing in our state, there were significant reductions to the permanent supportive housing and a shift towards transitional housing. And there was also, which was a huge difference and would have a big impact on the folks that are on this webinar here today, they also typically folks with a severe persistent mental illness counted as being disabled and eligible for HUD funded permanent supportive housing. And they made a change that would no longer be the case moving forward, that you either had to be physically disabled or over the age of 62. There's been a lot of pushback to that, some litigation, advocacy. So where that's all going to land, we still don't know, but it's just an important piece of information for the folks on this group to have. If there's any opportunity for anyone to help us and join us in the advocacy to make sure that that doesn't happen, because that would have a huge impact on the folks we all serve, we would encourage that.
So we will stay tuned to see what develops with that. Thanks for the explanation. And I know that was a little bit of a frightening time for some of us.
Yep.
I'll go ahead and hand it over to Maggie.
Yeah, thank you. So I will take this back to William as the Director of Housing for Broward Behavioral Health Coalition, our managing entity. Can you tell us a little bit about the role of the managing entity related to housing in our community, what your role is, and how the managing entity, works with the community to help individuals who are seeking homes?
Sure, yeah.
Thank you.
Of course, yeah, thank you. Well, actually, the managing entity is the entity that receives DCF funding, state funding, and federal funding. And then we contract with the behavioral health and substance use agencies within our communities. Fortunately, at Broward Behavioral Health Coalition, we only cover Broward County, but as you can see from this map, we have 6 other managing entities that cover the whole state. So there's a large area that these managing entities cover. Now, each of the managing entities have a housing director that handles, just like I do. We go by the guidance documents that DCF puts out. DCF puts out guidance documents in all areas of behavioral health and substance use, such as care coordination. Obviously, I'm in charge of the housing coordination for our managing entity, but it's in line with the gap analysis that we spoke about earlier in this webinar. But essentially what we try to do is fill in the gaps that have been identified, and we work closely with our behavioral health. We look very closely at our behavioral health agencies. We actually here at Broward Behavioral Health, we contract with 58 behavioral health and substance use agencies here in the community. So this next slide actually identifies each of the housing coordinators that are at the managing entities. Essentially, the managing entities cover, or what we call a safety net. We are the agency that covers people that are underinsured or have no insurance whatsoever. So that's where our contracting with the behavioral health and substance use agencies come into play. So anybody, whether they have the means to pay or not, is able to access those services that are greatly needed. Next slide. So we're going to go into a little bit of explanation. There's so many different levels of residential treatment across the community. We're just going to talk a little bit about this. These slides are going to be available to you after the webinar, but I just want to kind of talk briefly on each of the types of housing or residential treatment. One thing important to know about residential treatment facilities, adult residential treatment facilities, which are usually just set aside for individuals with SPMIs, severe and persistent mental illnesses, they're all voluntary. So if you have a loved one that's wanting to go into residential treatment, or their level of functioning dictates or shows that they need some sort of residential treatment, the key is to understand that these treatments work best when people voluntarily go into these programs, because they are short-term kind of treatment. For instance, short-term residential treatment facilities. This is the only type of facility that's locked, because it is a step down. Essentially, this is kind of one step from avoiding a state hospitalization. So it's a diversion to having individuals go from acute care facilities into the state hospital, where we try short-term residential treatment. These are level 1 residential treatment programs, and generally the length of stay is about 30, 60, 90 days, but it's based on the level of functioning. So a locus is an assessment tool that we use to kind of assess whether or not a person, what level they actually could benefit from. So the other types of residential treatment that we have here and across the state are level 1s, level 2s, and they're all based on the locus. The locus is kind of a driving analysis or survey that we do with individuals, just to make sure that they're going into the proper care. Because research shows that if an individual is placed in a level of care that's not appropriate, they tend to not do so well. They tend to decompensate. Just as it is true for individuals that stay in residential treatment for too long. So a couple of years ago, well, it's been more than a couple of years, but a few years ago, the length of stay for some of these residential treatment programs was quite lengthy. It was a year to 2 years. People were staying in these residential facilities. But research demonstrates that if an individual is ready to move on from that level of care, that they end up decompensating or kind of regressing if they stay in that treatment facility for too long. That's where the managing entities have kind of stepped in. And we have a department that actually oversees these beds across the state. And we do utilization management meetings on a regular, every month that we do these to review, the clientele that are in the beds, what progress they're making. Are they ready to move on to the next level? So we do this at 30, 60, 90 days. So we do this to make sure that people are moving on at the appropriate times, and then moving on to the appropriate placements. This is important because, one, obviously, residential treatment is not cheap. They range from level 4s range from about $80 a day to level 1s up to $309 a day for services. So we want to make sure that an individual is in the appropriate placement, and that they're making progress to where they can eventually live in a place like Stephanie spoke about, in supportive housing in the community. So again, we have residential treatment programs as well for youth and adolescents. So there's therapeutic group homes. Of course, these are 24-hour residential care, community-based mental health treatment used as a long-term residential therapeutic environment. So these are a little bit longer than the 30, 60, 90 days, because generally the youth that are under 18, they tend to need a lot more services and things like that in regards to stabilization and support. The other types of housing that we have for residential treatment for children is qualified residential treatment programs. And again, these are all supervised programs that come into play: 24-hour supervision, access to registered and licensed nursing, clinical staff. Of course, these programs, all of these programs, including the adult residential programs that we talked about, want to engage family members if there's family members that are available and willing and wanting to engage in these services. Because ultimately, we want to build supports that are natural for these individuals, not just depending on the system. Natural supports are a key component for people actually improving and kind of being able to move on, into the world. The third level for youth residential treatment is the psychiatric residential treatment facilities, non-hospital facilities that hold a Medicaid provider agreement to deliver inpatient psychiatric services. So these are a lot more intensive services for residential treatment. But again, these are some of the types of housing that are available to our loved ones in the community. Next slide. And of course, everybody's heard of assisted living facilities, or if you haven't, these are kind of a step down, one step down from maybe a nursing home. The good thing about these is that if a person's level of functioning kind of dictates or shows that that person needs some assistance with ADL skills, activities of daily living, they may need to have their medications monitored by a nurse, held locked in a lockbox where the nurses actually distribute to them on a daily basis. Physical transfer, sometimes they need assistance transferring from, say, a wheelchair to the toilet or from a wheelchair to the bed. These can take place in assisted living facilities. Now, these are very costly. These are more expensive than a lot of some of the other residential treatment types, but any type of residential treatment, we want to make sure that a person's in the level of care that they fit, right? We don't want them to be in an ALF if they're able to kind of improve their ADLs and then move on into an independent living situation. So we want to make sure that we're identifying those. Of course, there are supervised group homes for people with behavioral health conditions. These are generally homes that are in the community. They have typically only 4 to 6 people that are unrelated that live in the community. These are low stress, supportive, supervised environments for rehabilitation. I know the Boley Center in Pinellas County runs some of these types of facilities. Adult family care homes, these are kind of like a small assisted living facility, but these are licensed through ACA. And essentially, these are very, very small, like assisted living facilities to a certain degree, but the owner is required to live in these types of facilities, and they can't have more than 5 unrelated persons with disabilities living in these homes. There has to be 24-hour coverage throughout the house. And again, like I said earlier, the owner has to live in there. So these are we have about 9 here in Broward County, but these are, because of the licensing through ACA and stuff, there's few and far between of these programs, but they really do really good work. They typically work with a lot of more elderly people, some veterans. Some of them do work with people with behavioral health challenges. It just all depends on the community that you're in. But these can actually be found, and I'm going to talk about it in the next slide, but be found on the ACA website. Again, single room occupancy, those are SROs. We have one here in Broward, but essentially that is the one we have here in Broward is actually a converted motel that's turned into permanent housing. They have a contract with the Hollywood Housing Authority to where the Hollywood Housing Authority provides HUD funding to cover the difference in the market rent, and the clients end up paying only 30% of their income towards rent. These are great because the support case management services are on campus or on the property, and they often have a supervisor as well. So there is access to case management services 24 hours a day, 7 days a week. Very, very good model if you can find them. All right, next. And again, I talked about this earlier. This is a very useful website that we use often, very often, but it's just the ACA website. So ACA is the Agency for Healthcare Administration. This is their healthcare finder website. You click on the link. Actually, you can find anything that ACA licensed. Anything that ACA licensed, you can find on this website. For instance, if you're looking for an assisted living facility, you click on this website, you put in the county that you're looking for, you put in assisted living facility, it will bring up the assisted living facilities in that area. If you're looking for ones that have limited mental health license, which means they are contracted and able to have had training to provide mental health or behavioral health services, that will be listed under limited mental health license. So this is a great website. You can look up nursing homes, behavioral health treatment centers, health centers, anything, you name it. Really good website to go for. And then, of course, this is in regards to, of course, the managing entities. We receive funding for the behavioral health and the substance use. And then we do have a lot of co-occurring individuals, meaning they have their behavioral health diagnosis as well as substance use challenges. So we frequently in our areas work with FAR recovery homes and Oxford House. So FAR recovery homes are essentially recovery homes that are certified by FAR and NAR. They follow the NAR standards. They have a levels from 1 to 4, depending. Level 1s are generally peer-run organizations or peer-run houses. They're houses within the community. They're shared houses where individuals can be placed that have substance use challenges. Some have co-occurring disorders, but really it's a safe place for individuals to be able to try to get their recovery, their substance use recovery under wraps and be able to kind of learn those skills necessary to get beyond that and not, fall back on their substance use. These are excellent. The faronline.org website. If you're looking in your area, this covers across the entire state of Florida. If you click on their website, it will show you, just click on the county, it'll show you all the certified FAR recovery homes that are in that area. Now, Oxford House is another self-run, self-supported recovery house. This is a peer-run organization. They are national. They are across our nation and actually the world, really. If you click on their website, they have an excellent website. They're very new, not new to Florida, but their expansion in Florida has been really great. In 2019, we didn't have any FAR homes here in Broward County. We have over 10 now that are here. Often these programs are excellent because they actually have houses that take in single family or single mothers and single fathers into the home with their children. So the supports for substance use is there for family members as well. Peer run, again, these are democratically run. So the houses are supported by the income that they take in. There's usually a set rent that's usually done weekly as a weekly rent that they offer up. But really, really good programs. Oxford House, actually, you can see any one of their houses, where it is in relation in the nation. You look at the picture of the house, the vacancies, all of that is on their website. So,
William,
yes.
this is incredible information that you're giving us. I have a question for you. I run a local advocacy group here in Miami-Dade County, and a lot of our participants, we've been talking about these settings called independent living settings or independent living facilities. And our group has done some research into these and found that they're actually just rooming houses and there's no monitoring or anything of them. Can you tell us a little bit about those and how those are part of the system of housing?
Sure, yeah. Just like FAR, there used to be, they used to call them sober homes or halfway houses and things like that. And back then, there was a lot of those types of houses, recovery homes that were around, but some of them were not certified. Well, there wasn't certification. So FAR came around and NAR came around to have these homes certified. So, these unfortunately, these shared housing locations have popped up out of necessity. Because I don't know, and I came on to the managing entity in 2018. Prior to coming on there, I worked for Henderson Behavioral Health for 23 and a half years. We looked for apartments. We found apartments for our individuals for $950 a month rent, right? They're literally double that now. So some of these shared housing locations have much cheaper rents that are affordable for people that have low income, maybe on SSI, Social Security benefits. But the problem is not everybody's in it to provide proper care. So we actually at BBHC, and we're working with the county, we're looking to come up with standards for some of these houses. We actually we have some contracts with some of these shared housing so that we have some oversight over what goes on in them. They are, unfortunately, or fortunately, they're around because the alternative is that people are on the street, they're in the shelters, things like that. But we are hopeful that there's going to be a certifying process for these types of homes as well. But unfortunately or fortunately, they are around. They are affordable. They are a mechanism to keep people off the street, but we also want them to be appropriate for people.
Thank you.
I want to just jump in here and ask Amy. I understand that you've you have looked into and you have some personal experience with private residential treatment programs, Amy. Can you tell us a little bit about them? I mean, what type of programs are they? What are they? And how much do they actually cost?
Okay, well, this was a while ago, but my adult daughter went to a private residential treatment program outside of Florida, and I spent considerable time visiting a number of these private residential treatment programs in Florida and also in other states because we were trying to find something for her. They're, they're not part of the safety net system in that most of these are privately run. Some of them might actually be for profit. Some of them are not for profit. But the one that my daughter went to was actually saved her life. It was a farm work-based program, and she spent, I think it was 8 months total there, but they were able to tweak her meds just enough. There was a psychiatrist on site. They had group activities, and she had to work every day on the farm and in the facility. And the best thing about it was there were a number of group homes where the residents stepped down, and each group home had more independence in it, so that by the end, she was pretty much, living by herself. And she was also reintegrated in the community so that she was working at a volunteer job. And then she went back to college and got her degree. So that was like ideal.
Wow.
Each of the, there's a lot of these, there's actually several in Florida, and you can just Google, residential treatment programs for behavioral health. They vary tremendously in what they offer and in the cost. Some of them are extremely expensive. Some of them require a minimum stay, of 30 days or several months. They're all completely different. So if somebody wants to look into these, they really need to spend time actually to visit them with the person who's going to go there, because the person has to feel comfortable going into a residential program that's away from home. They have to feel comfortable. They have to look around, see the other people there, meet some of the staff. That's really important. Now, there is an organization called ARTA. They have a website, artausa.org, and you can actually look at different residential treatment programs around the country. They divide them into 4 types: apartment-based communities, clinical residential treatment, farm-based or work-based residential programs, or group residential communities. So, and most of these have been started by individuals who, have a family member or are themselves have some experience with mental health issues. And so they grow out of somebody's vision of, what can really help people.
Amy, will you dig a little deeper into that? What should a person consider when they're looking into a housing or residential care setting?
Yeah, so I mentioned it's important to visit, and so you can actually look at a place, you want to determine, well, what is the goal? What are the recovery goals for the person? Do they want to go back to work? Do they want to go back to school? Would this facility help them get there? Of course, some of them take insurance to a certain degree so that, maybe some of the costs are reduced, but the cost can be, $1,500 a month up to, I saw one $95,000 for a 30-day stay, which is, obviously this was sort of kind of a luxury place, but you want family involvement. You want the family to be able to have access to the person so that you can communicate and see what's going on. Some of the places are licensed. Some of the places in Florida are actually licensed through ACA. Are they evidence-based? Do they keep data on the outcomes of their residents? If you can find out about staff turnover, what's the staff ratio to residents? Is it in a safe area? Is it secure? in case the person runs away. You know, what happens if they leave the site? And, you know, each person should have an individual treatment plan just geared to their own needs. And, you know, they have to have a really good understanding of serious mental illness, you know, access to psychiatric services, and also the step down options are very, very, very helpful so that the person can start to reintegrate into the community if they've been isolated for a long time. Also, what's the average length of stay? You know, is it going to have a lasting effect? That's, of course, you don't really know that. It's a big investment, and you don't really know whether it's going to work until you actually, if the person's going through it. You know, you want to make sure it's not overly restrictive. And, you know, are there activities? Do they have the chance to do volunteer work opportunities, or have positive social connections?
All right, so we've heard about the gaps and looked at some information on finances and thought about the different types of housing. There's obviously more housing needed, more access needed. What can each of us do to try to make sure that that is a reality for the people that we care about?
Yeah, and so our organization and the Florida Mental Health Advocacy Coalition really encourage people to follow what's happening in supportive housing, especially right now with what's happening with the funding. So if you can sign up for alerts from the Florida Supportive Housing Coalition and the Corporation for Supportive Housing, which is the national organization, we really encourage people to join their local NAMI affiliate. And if you take a NAMI Smarts for Advocacy class, you can learn how to advocate for a particular issue by using your own story. And we also welcome people to become a member of the Florida Mental Health Advocacy Coalition so that you can join other family members and peers to actually get to learn about what's happening with bills that are happening in the state legislature. You know, meet regularly with advocates from around the state. We provide talking points and flyers and help you, you know, connect with your policymaker. And it's really a chance to have your voice heard and actually affect legislation, because we've even had the opportunity to help draft bills or to review bills and give feedback on them.
Thanks, Amy. All right, now we're heading into our questions from the audience. I do see some here in the Q&A. If you haven't had a chance to type your question in, go ahead and do that now. And I will begin to field some of these and pass them along to our esteemed panelist. So we have a question about how supportive housing might be different from recovery housing. Would anybody like to take that one?
I can take that one. Generally, when we talk about recovery housing, it's in relation to somebody that may have a substance use challenge. So they're more transitional kind of housing settings. The supportive housing is, like Stephanie had spoken about, you know, more independent living with apartments and supports, more permanent kind of a setting. So that's essentially what the difference is.
And there's another question kind of
I just wanted to
piggybacking.
just add to that I think the lease is the biggest difference, right? Like our tenants in supportive housing or tenants in supportive housing have annual leases that, you know, give them all the protections that any of us would have when we sign a lease wherever we live. I think that's a big difference between supportive housing and recovery housing, or some of the other, you know, group home or other type housing that we've talked about today.
Thanks for that clarification. And building off of that, you know, we know there are people who have mental health conditions only, people who have, they're in substance use recovery. Is there a barrier for people who, you know, meet different criteria according to, you know, what's their presenting issue?
Well, yeah, for instance, if you have somebody that's primarily has a behavioral health issue, you would not place them in a recovery home, a FAR recovery home. that's, we would want to make sure that we put them in a facility that focuses on the behavioral health challenges and needs that they have. And then, support that, with the supports that come along with the behavioral health system.
Thank you. And, we have some questions around access. What do wait lists look like for housing communities? Do we have any, do we have a finger on the pulse with that?
Well, and that actually speaks to the analysis and the surveys and the triennial assessment, needs assessment. Obviously, all of those are recommending more. We need more kind of residential treatment beds and things like that. Essentially, that's what the MEs are kind of put in place to do, is when we see the gaps and we see the needs, we try to kind of open up those options or opportunities within our community. For instance, if somebody's in residential treatment to go 30, 60, 90 days, and then they're ready to move on to the next level. But if there's no next level for them to go to, that's where the kind of bottleneck, so to speak, comes into play. So there's a need on all levels of types of residential treatment, even apartments, affordable housing, all levels of types of housing. There's a need. So that way we can have, I guess, the cod kind of working, everything moving along like it should. When there's not enough, that's when we get the bottleneck, and then we have longer wait lists and things.
Thank you. And we have a question around access for ALFs. Are some of them covered with insurance or Medicare?
Yes, they are actually. A lot of them, actually, if they do take Social Security income, but also they offset the cost because they are costly. If a person has Medicaid, generally the ALFs, assisted living facilities, will apply for long-term Medicaid, which then covers kind of the difference of the cost, and then also provides the supports that they need once they go into the ALF. So yes.
Yeah. And then thinking again about finances, how often are individuals required to have the facility become payee representative of their benefits?
It's not a requirement. I mean, some places may require it, but that's often in line with not having for instance, if say a family member or the person's their payee and then they end up not paying, that's when you might want to have somebody become the payee, so that makes sure that the services and the cost of the place is covered.
We have somebody speaking from an experience they had. They called a facility today and was advised of the cost, and it was expensive, and they may need to cancel their private insurance since insured with Medicaid and Medicare. They want to know, why can't the funding be combined? And it's very expensive. How can we get to a point the patient agrees to go voluntarily for help? And this woman's expressing that she's tired.
Well, I would encourage, I mean, I'm not sure what area she lives in, but I do want to reiterate reaching out to the managing entities and their housing directors for assistance. If you're having some challenges in this realm, they may be able to help kind of navigate the system for you. Depending on what type of insurance, if they have private insurance, you really have to look into the private insurance and see what they cover. Specifically in regards to ALFs, assisted living facilities, residential treatment. You really have to lean on them. A lot of them don't advertise. Some of these private insurances don't advertise some of the services, so you have to ask. Same with the Medicaid providers, the Medicaid HMOs and things. They don't a lot of times advertise some of the services that they pay for, but asking the question, you never hurts to ask the question and go directly to the source that actually may be the one paying for it.
I have a couple questions for Stephanie here. One person wants to know how you're funded. Do you get money from state or counties? And if so, are you impacted by Senate Bill 180?
So we get funding from a whole lot of places. It takes a lot of funding to make a supportive housing community come to life. On the capital side, to build the buildings, we typically receive funding from Florida Housing Finance Corporation. We compete for the 9% tax credits. and the additional funding from Florida Housing that comes along with that for supportive housing development, such as sale funding, or some of the other ELI loans that Florida Housing has in place to support the production of permanent supportive housing. So once we, assemble together the financing to build the building, then we need to cobble together the operating funding, the supportive services funding to sustain the building. For operating subsidies, we typically go to housing authorities or to the Veterans Affairs Department for VASH, or all sorts of different operating subsidies that we cobble together to bring enough operating subsidy into a building to be able to operate it properly. And then we cobble together the supportive services funding. We typically go to our local COCs, to managing entity, private grant foundations, any place that we can find some funding to put together to support the services that we provide in our housing communities.
Thank you. And we have a question about your locations. Is there a place where people can find out where your locations are?
Yep, our website has a listing of all of our housing communities, but just, real quickly, we're in Miami, Broward, Dade, Brevard County, Marion County, Polk County, and in Fort Myers.
Palm Beach County?
Palm Beach, did I say? Yes, Palm Beach. We have one community in Palm Beach. Sorry if I missed that.
Thank you. Okay, kind of jumping around. In addition to those you mentioned, FAR and Oxford House, are there any additional resources you'd recommend regarding recovery housing or for those with co-occurring conditions?
Well, the FAR, we utilize FAR in the Oxford House because, well, FAR is, they're certified, and obviously Oxford House are, have the national certification. So, our behavioral health and substance use providers are not allowed to refer somebody to a non-certified recovery home. So we strictly stick with the ones that are actually certified, because we feel they work the best, and they actually, they have standards that they have to abide by, and the clientele actually really do well in the FAR recovery homes and the Oxford houses.
So I'm going to continue to jump around a little bit and try to combine some things. But I'd like to start this question regarding permanent supportive housing in Florida. Are most of the developments a mix of serving low-income families, elderly people with serious mental illness in each building? Or are there supportive housing models that are specifically designed and staffed for people living with serious mental illness? If it's the latter, how is Florida able to stay in compliance with the state's homestead plan, which typically require less segregated settings?
Right. So that's been a challenge, and that's part of why there's been a move to these mixed communities where there's a diversity within the population in the building. So, I think, Carrfour has some communities that we built early on, 25 years ago, that are 100% supportive housing. When we have the opportunity to diversify that, we do, and we're in the process of actually figuring out how to make some changes to our earlier developments that are still 100% supportive housing within one site. So there's a mix. If you look at the different communities that have been funded by Florida Housing throughout the state, there are some that are 100% supportive housing, and they have had to deal with the Olmstead Act and how to navigate around that. You'll see some that are 50-50, 80-20, 70-30. You kind of see the whole array of different combinations. Our experience has been that the more you're able to mix populations within the building, the better the building operates. It's a better experience for the folks living in the building. It's more, it's better received by the surrounding community, by the neighborhood. If there's less NIMBYism when you're building a building that has a diversity of populations and backgrounds. So whenever the funding allows us to do a mix, that's our preference and our preferred model.
Thank you. Rather than having to return to the correctional facility to await a hearing to resolve criminal issues, are there housing facilities for patients to be placed when discharged from the South Florida Evaluation and Treatment Center?
So I could speak to that. Actually, the MEs, the managing entities, have agencies that are in place to work with those individuals that are in those treatment centers. And typically what they're in line to do is they have the visits with them while they're up there, and they're supposed to work with coordinating their returning to the community. And the idea is to do it before they actually get returned and try to find them placement. Now, for instance, if they have, say, a substance use background or whatever, that may be somebody that we would put into a FAR recovery home. Or if they're in need of some sort of residential treatment, we may have them screened for, depending on the level they needed, screened for residential treatment. So it just depends, but there are coordination teams that are directly involved through the MEs in the provider network that we have that are to assist with those types of returning citizens.
This one is more location specific. She wants to know about regarding correctional facility needs. What's the latest on the building on 22nd Avenue? I'm not sure what city that is. That has been completed but not opened.
I think that's probably Judge Leifman's new program in Miami. Not sure, but it sounds like that's the address. And I'm not sure. I know that they were still working on cobbling together the funding to operate it, but I'm not sure the status of that.
Stephanie, regarding Carrfour, can you speak to whether, do you know if there are openings or if there's a wait list for your properties in Miami and Broward?
Yep, there is a wait list. For Broward specifically, we do receive the referrals for our Southwest Hammocks development through William, through BBHC. In different communities, we receive them through different ways. In Miami, the bulk of our referrals come through the Miami-Dade Homeless Trust, which is a continuum of care in Miami. In Brevard as well, we get our referrals through the local COC. And we also operate affordable housing that is not it's within the same building. It's the affordable housing that's separate from the supportive housing units within the housing communities. And those wait lists we manage ourselves. Carrfour manages those wait lists, and we don't have any openings right now, but we do continue to add names to our wait list for when we do have availability.
Thank you. I'm going to bounce over to Amy with this question. Do you have recommendations for parents with children or grandparents that are guardians of their grandchildren if the child or parent may have a mental health diagnosis? So, how do family members handle this issue?
Oh, I don't know. William might be better to answer that question because I know that, and Stephanie too, I mean, in supportive housing developments, families, some of them can accommodate families, correct?
Correct. Yeah,
I don't know if that answers the question, but yeah.
Yeah, in our communities, we don't define what a family looks like. If you apply to live in one of our communities and you apply with whoever you're living with, I think I saw a question about shared housing on the questions and answers. There is a move towards encouraging shared housing, and we much prefer when folks come to us as a unit, whether they're blood related or not, but as what they consider their social network or family that they would like to live with. It works much better when folks are coming to us with someone that they'd like to live with and are ready to enter into a lease together, rather than any kind of forced shared housing where we're identifying a potential roommate for somebody.
And if the person who asked that question, if that didn't satisfy the question, it was a different response you were looking for, please let us know. We can come back to it. So yeah, anything else that anybody would like to add on about FHFC change on allowing for shared housing?
I just want to say that we've had mixed success. We've had some shared housing pairings that have been great. And again, I think they usually work best when folks are coming to us saying, I met this person, at the clubhouse, it's a fellow member, and we'd like to try living together, rather than us trying to figure out how to pair folks together. Supportive housing is permanent. I think what often happens when you enter into these different types of living situations that are different than any of us would typically live in, it doesn't lead to permanency, right? It becomes more of a programming, more facility-like, and doesn't end up leading to permanency. Maybe folks want to live with someone that they met, recently for a year, but it's not something that maybe they see themselves doing, for 10 years or even 5 years. So we really encourage the view of permanency in our permanent supportive housing developments. Is this something that's sustainable and something that you see yourself, being able to live with, or, is this an environment that you can live in comfortably permanently? And sometimes these shared housing or, other kind of arrangements that aren't typical often don't lead to permanency.
Yeah. We have a question about dual diagnosis. I'm wondering if the person who asked that question could clarify who they're asking it to, but they want to know what about dual diagnosis? Do you focus on adult mental health instead of recovery from drugs and alcohol? So what does that look like within the scope of programs that you're working with?
Well, I would say, most of our behavioral health, community behavioral health providers do have dual diagnosis programs, specifically. So they're able to handle, individuals that are diagnosed with a mental health diagnosis, but also have that substance use history as well. They go hand in hand a lot of times. So, you treat the whole person generally, but there are many dual diagnosis programs across the state.
We have a question, and this may become an advocacy related question, but everybody can feel free to chime in if they have any input. Can you speak about some of the legislative bills that have been introduced this session that will impact housing in the space and the landscape shifts that are taking place? I know you touched on this earlier, Stephanie, but anything else that we might want to add? Any other things that are coming up that are pertinent for the listeners to know about?
No, just to keep on following, a lot of the updates that the advocacy groups are putting out, and following their lead, right? There's a lot of momentum around really encouraging the continued level of funding that our communities need for permanent supportive housing, and making sure that adults with severe and persistent mental illness are included within who is eligible for those services. So it's important to just kind of, look out for those updates. And usually those updates come with what you can do next, because this has been evolving literally daily. So it's important to just watch those advocacy updates and what the groups that are taking the lead are encouraging folks to do to be helpful.
I'd like to see if Gail Giese from FLMHAC would like to respond.
Yes, thank you so much. At FLMHAC, we're looking at any kind of bills that would help provide housing for people with serious mental illness and or substance use conditions, always. And we always support full funding for the Affordable Housing Trust Fund. As Stephanie mentioned, those sale funds, some of those go on to Florida Housing Finance Corporation, and then from there go on to what they call RFAs, or requests for applications, that allow them to get that funding for supportive housing. So you can always support full funding for the Affordable Housing Trust Fund. And we always talk to our legislators, even if there's not a bill about supportive housing, it always comes up as a top area of need amongst all of our members. And so we always put supportive housing right at the top of our list. And I encourage you to do that. And we have flyers about why that's so incredibly important. So I encourage you to join FLMHAC, and we'll get you all that information. Thank you.
Thank you. So Amy, you spoke earlier about a farm. Are there any plans that you're aware of, or that anybody is aware of, about creating a farm experience in Florida? Do we know of any places that are available now?
I was going to answer that, but I'm not aware of any farm-based program for people with serious mental illness in Florida, unless maybe somebody else is. The ones I'm aware of are in other states, like Gould Farm in Massachusetts and Cooper Reese in North Carolina. But you could Google it and you might find out something from AI, whether there is any place in development. Stephanie or William, have you heard of any?
I have not. I mean, they're a great idea. I have not
I haven't.
heard of any, not in Florida.
Yeah, what's really nice about a farm-based program is the setting is just so peaceful, working with animals, working with plants, growing vegetables can be incredibly therapeutic. That's a great start to the recovery process. And I know that a lot of clubhouses have gardens where people tend the gardens, but that's not the same as a residential farm program.
For that. I would love to go to a farm right now. The information and resources presented and described here are so important, especially for families wanting to make the best next steps for their loved one upon discharge from a Baker Act facility. Communication and assistance with hospital staff is scant, and families end up floundering. Do you know how these facilities can learn to improve this gap for the greater good?
Well, that's typically why, the managing entities are a big part of those trying to fill those gaps. So you really, if you're having those kind of challenges, I would highly encourage you to reach out to your managing entity, or whichever it is, because those are the gaps that we're working on. Those are the communications. Those are the agencies in the network that we are partnering with, and we're working towards trying to improve all of those types of concerns. So highly recommend reaching out to the managing entity if you're not getting anywhere.
Thank you. And people can find a list of managing entities online. Is that right? Where would they go?
Yep, that's right. You can look on the Department of Children and Families website. Also, just Googling managing entities in Florida. It'll bring up those lists like we had on the PowerPoint. And actually, you're going to have access to this PowerPoint too. They're on there as well.
Thank you. The attendees and really the range that this webinar covers is across the whole state. We have a question here about organizations and groups that work primarily in the recovery housing and reentry navigation space. How would people find those groups in their area?
Well, FAR is across the state, so is Oxford House. So those in the recovery housing, I would recommend reaching out to the FAR administration. They have a really knowledgeable group of people that run that organization, and very, very helpful and very wanting to help individuals. So I'd reach out to FAR. And in regards to returning citizens and that sort of realm, I would reach out. Again, I'm going to say reach out to the managing entities, because that is part of what we do. We have providers that have, we work with reentry programs. We work with the mental health courts, diversion courts. We have community courts here in Broward. I mean, we work very closely with, because we don't believe people that have behavioral health or mental health challenges and substance use challenges belong in jail. So we work very closely with the court systems to try to divert people into services and treatment rather than keeping people in jail.
Thank you, William. And somebody did type into the Q&A the link for the managing entities, so feel free to go and click on that. And then Anna had a question. I'm not quite sure how to ask it. Anna, if you'd like to ask it live, feel free. If we could have one of our hosts unmute her, if she'd like to ask that out loud. Or you can also type into the chat.
Yes, good evening, everyone. Well, good afternoon, definitely. Thanks for all the information. Everyone is very valuable. My question is, because I've worked in certain areas where I have did trainings where it seems like some of the agencies that we utilize to get the support services also basically they create somewhat like a pathway to be able to navigate the criminal system to create. It's kind of like I don't want to say they're corrupt, but it's kind of like they create a pattern in the system to create the mental health round, to create the homelessness, to create the stagnation in our community support services, where it seems as though people who are utilizing the drugs and utilizing the alcohol and constantly being reincarcerated, though they do need the services, it's the system that creates that climate that actually creates that consistency in that sense. Because I'm looking from here to Miami, from here to Palm Beach, as I do mental health advocacy throughout Broward County in different areas where a lot of the systems know about Maslow's hierarchy, but a lot of the systems that basically are criminal justice and different things, they utilize Maslow's hierarchy as like a staple to keep the people reincarcerated in that sense.
Well, I can speak to the work that we're doing. We have a Stepping Up initiative that is set in place here in Broward that we work on. I'm actually part of the housing piece of that, but we work very, very closely with the mental health court judges. Broward County is actually the first community that has set up community courts. So, for instance, for individuals that are experiencing homelessness, rather than being put in jail, they are given a summons to go to community court. And in community court, us managing entities or Broward Behavioral Health Coalition, we have our provider network that go into these community courts. Right now, they're in Pompano, Fort Lauderdale, and Hollywood. So three big cities here in Broward County. These community courts are essentially put in place to kind of help individuals get access to services rather than, putting people in jail where they sitting in there waiting for their hearings and things like that. Broward County was the first misdemeanor mental health court and first felony mental health court in the United States, and is still thriving. The judges that work within that within that system, including our drug court, our veterans court, we have a lot of specialty courts that work to kind of keep people out of jail that are experiencing homelessness or experiencing behavioral health or substance use challenges. So, I like to think that we have quite a bit of services in that regard. And again, this speaks to, though, the need for more housing and more places for people to go to, which actually housing keeps people out of jail, keeps people out of the hospitals and things like that. So it's a full circle, but that's where the need for housing and it speaks to that.
I'd like to acknowledge there have been some emotions in the chat. We've had a range of people saying, okay, great information, but in actuality, access is difficult, or, advocacy is so important, and people are getting kind of fired up about some ideas. Gail and Amy, you are longtime advocates. Do you have any words of wisdom to share with people who might be feeling frustrated and looking for access or inspired for advocacy?
Well, I was going to let Amy start, but I will. Amy's group actually gave us the courage at NAMI Broward County to start working with our managing entity and Carrfour to advocate for what eventually became Southwest Hammocks. And we didn't get a chance really to talk much about the clubhouse and how important the clubhouse is to adding stability for people living with serious mental illness in the community and giving them vocational opportunities and a social network and activities throughout the day. And we really feel that it's a great model and builds community. So I would suggest advocating, getting connected to your local NAMI, and Amy, you want to add to that, because Amy got started with the Key Clubhouse and connecting with Carrfour. And it's great to get to know who your supportive housing developers are and who your advocates are, like your NAMIs and Mental Health Americas, and your managing entities, and also your behavioral health providers who can help you with all of this. Go
And-
ahead, Amy.
And if Amy, if you would say what your group is.
Oh, it's the Key Clubhouse of South Florida. And because of our relationship with Stephanie at Carrfour, it all has to do with building relationships with partners. And, grassroots efforts can sometimes result in amazing things. Like I think Carrfour was probably a grassroots organization when it started. Some of the most effective mental health organizations were grassroots started. So it's just a matter of connecting with people who have the same passion and interest that you do. And, it takes time, it takes patience, it takes a lot of work, but, we're trying to work on developing another housing project in Dade County. It's going to be really hard with the cost of land and everything, but, it's just something that takes persistence and, joining with other people, as many partners as you can find.
And one more question on that topic, and this will be the last one of our Q&A because we're at the end of our time. We have an attendee who is interested in helping to get a jail diversion program, mental health court started in Santa Rosa. Any recommendations?
My recommendation would be, reach out to me and then I can put you in connection with the judges that do it here. I'm sure they would be happy. I know some other communities have reached out about the community court, the homeless community court that we have, and I put them in connection for Jacksonville. So our judges are always willing and wanting to spread their knowledge and how it's working. So reach out to me.
And what's the best way for people to reach you, William?
wking@bbhcflorida.org. We'll put that in the chat.
Thank you.
So,
Go ahead.
yeah, we have to end the question and answer session, but boy, those were wonderful questions. And I really appreciate our expert panelists for answering them so well. This is a big thorny topic and there's a lot of work to be done. So we do have to get together and do it together. But I would like to thank again our webinar sponsors, Premier Wellness of South Florida, Bristol Myers Squibb, and Citrus Health Network for helping us put this together. And also thanks to William and Stephanie for joining us and helping so much with the hard subject matter of this webinar. We really appreciate it. So following the webinar, there's going to be a survey that pops up, which we encourage everybody to answer because it will help us create our next webinar and give us an idea of how we did with this one. That's really important to us. And if you enjoyed this free webinar and believe in our mission, please visit our website and sign up for future webinars. Also, we accept donations. We're a tax-exempt organization, floridaadvocates.org, and we accept any donations. We're a volunteer organization, and we appreciate any support that we can get. And also, if you'd like to access the slides and a recording of this webinar, it's all going to be available on our website. It's www.floridadvocates.org, floridaadvocates.org. Anyway, and also if you're interested in learning more about becoming a behavioral health advocate, please consider joining the Florida Mental Health Advocate, the Florida Mental Health Advocacy Coalition.
Yeah, and I wanted to add something to that because we didn't get to the slide. I thought we had a slide about Florida's Supportive Housing Coalition. That's another wonderful organization that you can join to advocate for more supportive housing in Florida. That's fshc.org. There it is. Thank you, Amy.
Yeah, we did show it.
Oh, good. I just missed it. Thank you so much. And also csh.org. That's a corporation for supportive housing. And you can sign up for their action alerts, and that's national. Thank you so much for being here.
Yes, thank you to everybody for joining our webinar today.